different, somewhat different from WBC in terms of that calculation part and also the counting of the cells, because the squares are more in number in the sense that there are more divisions. In case of WBC, if the large square is, what is the dimensions of the large square? Dimension of a large WBC square, anyone? 1 mm into 1 mm. So when 4 such squares are counted, the area is 4 into 1 square millimeter. If we talk of the volume, in the books it is written volume of squares. I will ask you to write volume of blood overlying the squares, because squares are lying on a 2-dimensional surface. The depth is, after the cover slip has been put, we calculate the, consider the depth as the gap between the cover slip and the grid, counting grid. So very strictly speaking, it should not be called volume of the squares. In that space the blood is lying and we are counting the cells, and the blood cells are seen over the squares, that is actually in the space between the cover slip and the counting grid. So it is the volume of the blood overlying the squares. Like I just told in the class, those who are there cannot be, it does not make any sense if we call volume of the floor. It can be the area of the floor or the area of the room, area of the roof, but the volume of the room, because this room, these walls have a height. So without that dimension we can't speak of any volume. So it's not actually the volume of the squares, it's the volume of the blood overlying the squares, and as blood is uniformly distributed after charging, so very loosely we can say it's volume of the squares, but it is actually volume of the blood overlying the squares, that is into 1/10 millimeter for the 4 squares. So it's 2/5 cubic millimeters, millimeter cube. Square millimeter can be written as millimeter square. So this is for WBC. So 2/5 millimeter cube is the containing the number of cells which you are counting. Say capital X, which is actually you are counting 4 squares. And what is the rule of counting? How do we count in case of WBCs? We count this as a whole. Number of cells are less, so it is usually not required that you count these smaller squares separately. We can usually, with our eyes under the eyes on the eyepiece lens, we are counting the cells under the microscope. That is, we are counting this whole large square together. It is not usually required that we count the individual smaller squares. It is not required. But still, why the squares are made, then it is just for the sake. If there are more cells, then we may require the smaller squares, but still smaller squares are not required. In case of RBC, large, then this, after this division there is another type of division, because the number of cells will be still huge. If we just, so that will not be sufficient, perhaps only two divisions. So here, do you get it? So please interact. Okay, in the, at least interact in the demonstration classes, otherwise it will get more difficult if you don't understand anything and just try to mug it up. So 2/5 millimeter cube contains X number of cells. So 1 millimeter cube of that blood contains X by 2/5, that is 5X by 2 number of cells. But this 1 millimeter cube is undiluted, sorry, diluted blood. Blood diluted with Turk's fluid. As the blood has been diluted 20 times, and you should know, you have done it, so you know how to dilute and why is the dilution factor 20. So it will become 5X by 2. In case of undiluted blood, it's 5X by 2 into 20, that is 50X number of cells, and you put X and get your result. That is what to do in WBC. or what you have done, most of you have done. Hope so. But in case of RBC, what is the difference? RBC squares have, by those triple lines in the non-counting squares, RBC squares are divided a step further. That is, the large square is again, what is the dimension? 1 mm into 1 mm, and that is divided into how many? 5 into 5, 25, not 4 into 4. And this is the difference with the previous version of the counting grid or the Neubauer's chamber. That's why I am calling it improved Neubauer's chamber. So in previous one it was 4 into 4. So more number of divisions leads to better counting, means as the number of cells are more, for the sake of counting it correctly, we are dividing into greater numbers. So 1, 2, 3, 4, 5 into 1, 2, 3, 4, 5, 5 into 5, 25 for the central large RBC square, central of the whole counting grid. And what do we count? Do we count all these 25 square cells in all these 25 squares? Firstly, it will not possible to be count in the large square as a whole, 1 mm square into 1 mm square. So many number of cells. So we divide this step further. So will it be possible to count all these 25? Like we are counting all these 16 in WBC. Actually, we are counting not 1, 2, 3, 4, 5, 6 up to 16. We are counting as a whole. Do you get it? In RBC, we are not doing it. And even if it will not be, it won't be possible as a whole. And will it be possible to count all 25? Perhaps no. Okay. We have to keep it as far as practicable as well. So what do you do? We count the 4 corner squares and the central one. Now, you may say instead of 5 we could count 10. So, instead of counting 5, if we count 10, instead of counting 10, if we count 15, then perhaps our result will be more accurate. But to keep things practicable, we count this 5. Now, why the 4 corner and the central square only? Why not these 5 or these 5 or any 5 according to our choice? Why not? What can be the reason? I think, see, everything won't be, perhaps some things are made out of common sense. So they are, maybe that's why they are not written in books. Why not? Why are they not written in books? Why do we count the 4 corner squares and the central squares? Yes, uniform distribution. Uniformity means what? Uniformity? Distribution uniform. We are already during the experiment. Without uniform distribution, firstly the experiment won't be possible itself. Say, so that the charging is done such that we have to practice it and do it such that both the counting grids are filled up with blood, and hence the cells will be there. Okay. So as we are considering uniform distribution, perhaps to corroborate that, or perhaps to corroborate that, we find that whatever will be there in the corners, that same density of cells, that similar density of cells would be expected in the center. If it was not uniform distribution, okay, only this part of the grid has filled up, this part has not filled up. So we have to count these cells. Cells means, sorry, squares. Cells in this context, cells will mostly mean the blood cells. So don't call these cells. Squares are sometimes called cells, but in this case, counting grid, we call these squares, otherwise we will confuse. Red blood cells in the, over the, not again, don't write in the squares. Very strictly speaking, it should be overlying the squares. It is not getting into the squares. So it is overlying the square, just over the counting grid, over the squares, and below the cover slip. There is blood and the cells in the blood. So we are counting these central, these 4 corner and central. Now, due to the how the triple lines divide it, already you know, every square of this 25 is divided into how many more? 16. That is 4 into 4. 4 into 4. So it is 1, 2, 3, 4, 5, and this is 4 into 4. Now we count for counting each such square. Maybe this is the left upper of the RBC squares. WBC squares are also counted as left upper, right upper, and it is easy to find. That is left upper square, as soon as you count, we move through the triple line square. Just imagine it, just think it in your mind, the picture, the grid. So we move the triple lines, that square we just move to the right upper one, then we move down to the right, and it is easy to find out, because in between are the triple lines, the 1 millimeter into 1 millimeter, that triple line square, which is not for any counting. So it is easy to find those also. Here left upper, right upper, in case of the central RBC square, among that the left upper medium RBC square, right upper medium, which we are calling the medium, this square which has dimension of, and don't write 0.2, you will again confuse. Mathematics, arithmetic calculation is better done with fractions. If you go on to write 0.2, it will be correct, but there may be mistakes in calculation. So write as 1 by 5. Left upper, right lower, left lower, and central among the RBC squares, each is again divided into 16. Now even to count this one, as density of cells are more, we need to count these 16 individually. And what is the rule of counting? There is a rule of counting that is called the L rule. L rule means when you are counting, say this, out of the 16, the first one, that is, conventionally we count from the left upper side, so left uppermost of the left upper square, that is. So we start with that, and when we consider this cell, if we try to count, cells will remain, cells are uniformly dispersed, cells will remain on the number of, these margins also. As there are lines, there will be cells over the lines, but there are so many cells. So why this rule of L? This rule of L says that when you consider this number 1 square, say, that is the left uppermost of the left upper, right? So number 1 square, if that is number 1, say 1, 2, 3, 4 up to 16, or square ABCD up to 16 letters. So that square, small a square, if you name it as small a. So while that square, if I count all the 4 margins, the central portion will be counted, all the 4 margins, there is a possibility when I count this B square, what will happen? I again count this, and these cells are double counted twice. So it is done, the left and lower margins are considered, but the right and upper margins are left out. Similarly, in case of B, left and lower margins are considered, obviously the central portion will be considered, this portion of the square. Similarly for all cells, A, B, C, D, you will name them A, B, C, D, or 1, 2, 3, 4, whatever. That means name them in your mind, no need to name them. So that we are counting all cells. So go from this side, you count 1, 2, 3, 4, then 5, 6, 7, 8, and this is in focus. You have to keep them in focus. The left upper square is in focus, that can be made in 40x. The whole square is in focus. So you be careful, you count all the squares. Then what happens? This total has been counted, and what has been counted? This L, this L, consider it as L, and so whole this central portion has been counted, and these left and lower margins has been counted after counting all the 16 squares. What leaves is right and upper margin of this whole 1 by 5 into 1 by 5 or this square. You count it at the last. In books, I think it is written, that means the counting, that portion is not written, but I think you count it, it will be more accurate. There will be few cells there also. So after this is complete, by counting the 16 squares individually by the L rule, count this right margin and the upper margin. So the left upper square is complete. Right here, write x1 is equal to so many cells. Okay, or you can write it as x left upper is equal to so many cells. Now what to do? Now in case of WBC, it was easy to move to left upper to right upper. There is just one triple line non-counting square in the middle. But here what to do? You have to move 3 squares. It is also easy, but move 3. The 4th one will be the right upper. Now identification is important. So first one, conventionally we start from left upper. How to identify? On the left and upper side there will be triple lines. On the right and lower side there will be RBC squares. identical RBC squares. This is how to identify any corner square. On the left and upper side are the triple lines, non-counting squares, triple lines. Okay, and then the left and the right and lower side are the identical RBC squares. This is how to identify. Now, when you move 4 squares and reach the right upper, you already know I have moved 4 from the left upper, so it has to be right upper. But you also confirm that to the right and the upper side there are triple lines, and on the left and the lower side are the identical RBC squares. Then count similarly, and it will take time. I am just saying one word, count similarly, so it will take time. As you have counted all these 16, again rule of L, again counting. So write x right upper is equal to so many. So after this come down 4 squares, after right lower go left 4 squares. For the central one from the left lower you have to go 2 squares up and 2 to the center. Again that is the same question. Instead of reaching the center, I could count any of the other if I have to count 5. But for considering uniform distribution, I have counted the corner ones and the central ones, so that is the reason for counting the central one. So there will be 5 figures. The capital X is, or the whole number of cells counted is, x is equal to x1, x2 plus x2 or x left upper, x right lower up to the 5 squares. That is the total cells, number of cells counted. Now, how can the calculation, what is the calculation part? So, 1 by, what is the total area of the squares counted? This is 1 square, this is 1 square, each is 1 by 5 into 1 by 5. So, area of the squares is this, and we have to multiply it by that 1 by 10, which is the gap between the counting grid and the, so it is 1 by 50 millimeter cube, which means this is the volume of the blood overlying the squares and volume of diluted blood diluted with Hems fluid. 1 by 50 millimeter cube contains x number of cells. So 1 millimeter cube contains x by 1 by 50 into 50x number of cells, right? So 1 millimeter cube of undiluted blood will contain, here the dilution factor is 200, 101 minus 1 by 0.5. That comes from the dilution pipette, 0.5 of blood, and it has been diluted 200 times. So 50x into 200 is 10,000x. Okay. So 10 to the power 4x, 10 to the power 4 into that x. So this is how it is calculated. Actual calculation should be, because this is mathematically correct, because I have counted these 5 squares and the area is such. But actually in case of WBCs I have counted the large square. But here if you go by the actual counting, what should be the calculation? This is done like this and this is correct, but what should be the calculation part? Actually I have counted how many squares? 16 over here, then 16 over here, 16 over here, 16 over here, 16 over here. So those 16 squares, what is the area of each such square? This 16. Okay, area of each such square 1 by, what is the area of, or what is the length of each such small RBC square? 1 by 1/4 of 1 by 5, that is 1 by 20. So area of one such square is 1 by 20. I have counted 16, 16, 16, 16, 16, that is 5 into 16. So this is the area I have counted, and the volume is into 1 by 10 millimeter. This is the counted, this will come to 1 by 50. Same thing, better it should be written like this, because I am actually counting all these 80 squares. I am not counting those 5 squares, that means 16. This left upper square as a whole, I am counting actually 16. So better it should be written like this, but the previous calculation is also correct, because I already know the structure of the squares, how it is divided. But actually if I go by the counting, it should be written like this, that 5 into 16 into this is the area of the squares, each square counted. Okay. So this will again come to 1 by 50, that it has to be the same. See, just this is 80 or this is 4, 4, 5, 1 by 50. So 1 by 50 is the total volume counted, total volume of blood that is overlying those squares. So it should be written like this if you be very particular about it. Otherwise you can write it as 5 into 1 by 5 into 1 by 5 into 1 by 10. So this is how to calculate, and now the rest part is whatever rest, there is nothing to actually discuss theoretically. We have discussed about the structure of the chamber, we have discussed about the calculation. Rest is doing hands-on and practicing, so that what are the important steps? First is precautions. One is during drawing of the blood by the pipette, there should not be air bubbles. It should be drawn exactly up to 0.5. If you draw it up to 0, instead of 0.5 into 0 up to 0.8, then dilution factor will change. What will be the dilution factor then? It will be 101 minus 1 by 0.8, not 0.5. And as you go on decreasing the dilution, if the density of cells is more, it will act. Why do you dilute the cells? Otherwise, in undiluted blood, it will not be possible to count so many cells. So without dilution, it is not possible, and it has been seen that standard as 0.5 is optimum dilution. If you take only 0.1, then mathematically we may say it's 101 minus 1 by 0.1 is the dilution factor, then blood will be too dilute. Again, if we take it as 1, then blood will be not that sufficiently diluted so that counting is possible accurately. So we have to 0.5 has been standardized. But mathematically, if it is instead of 0.5, it is 0.6, then it should be okay. 101 minus 1 by 0.6, but that will become a cumbersome figure, which is difficult to make the final calculation, because without the calculator or this mobile calculator, that means without aid of a machine, without aid, so artificial intelligence, what we call it now. So that is human calculation. 101 minus 0.5, figure, convenient figure comes, that is 200, okay. Or 101 minus 1 by 0.7 will make it a cumbersome figure, not suitable for calculation. So that's why 0.5, and that suits my purpose, suits our purpose. Dilution factor 200. Precautions to be taken: this air bubble should not be formed, and then fluid should be sucked up, it should be thoroughly mixed, and then it has to be discarded, and with caution, so that anything in the bulk portion is not discarded. So very gently it has to be discarded, only the fluid portion below the stem, and then charging has to be done correctly. Keeping the cover slip of the Neubauer chamber, I have already put the focus, so it is written, you find in books it is written. Already I have whatever after charging, I need to count from left upper square. So it is better, I have already, before taking blood into the pipette, I have already, the focusing is done as it is required for counting. So as soon as I take out the Neubauer chamber and keep it on the table, keep the cover slip over it, charge the blood, and then as soon as I put, and then again with the course adjustments, not the course adjustment screw, just move the platform side to side with the focusing is already there, that the vertical length which should be between, or the vertical space which should be between the slide, do you get it, between the slide and the objective lens, or between this apparatus and the objective lens, I have already said that, so that just by moving it side to side, the focus will automatically come again, that is the left upper square. Before drawing blood into the pipette and charging, I have already focused the squares once, so that after drawing the blood, that time it is very delicate to handle. If it is not handled properly, blood will spill out. So after putting that, we put it very gently, and so that the focus can now easily. So if we do not focus beforehand, now go to focus, then this handling won't be that gentle and delicate. So that is a very intricate part. So first focus the squares, whatever we need to do after charging the blood, then draw the blood and charge, then focus again and continue counting. So this is how should be done. So step by step, and without practicing this you will make mistakes. So not only one day, even the next week also we will be continuing with this same topic. Okay. Now if anybody thinks that I have done one day so I need not come, so that is up to you. 75% attendance has to be there. That is mandatory from the university side. But if you say that I have already attended this class, I know everything, without practicing you can't perform. DLC and this total count of RBC, WBC, it requires practice at least more than 2-3 days, at least 2-3 days. Then again we will revise when we get time. This is mostly it is hands-on. You have to know the theoretical part and you have to practice hands-on. Now I think you may start, because there is nothing more to explain. What has been explained in the already in the demonstration room, not only today, before also. Now if you are not attending, we can do nothing about it. Yes, this is this detachable. This is called the eyepiece lens, where you put the eyes. These are simple, and these are called the objective lenses. This much you should know. You may not, maximum you may have forgotten. You may not know about the condenser position and all, but at least the lenses you should identify. These are the screws for moving the platform. This is the coarse adjustment screw. See, this is moving through a greater distance. With the fine adjustment screw, nothing moves. You have also joined in January. So your roll numbers? 117 and? So 117 and 121 both. Her partner is absent. So if her 117 is here, you are 116, 119. You have joined earlier. তোমরা তো আগে থেকেই আছো, তাহলে জাস্ট একটু এক্সচেঞ্জ করে নাও ফর দ্য ইনিশিয়াল ফিউ ডেজ, কারণ দুজন এক জায়গায় নতুন হয়ে গেলে ওরা মাইক্রোস্কোপ সম্বন্ধে ঠিকঠাক জানে না। তো তোমরা একটু এক্সচেঞ্জ করে নাও, এগুলো একটু নিজেদের সঙ্গে নিজেদের করে নিতে হবে। তুমি এখানে চলে এসো। আমরা মানে ক্লাসে মেনটেন করার জন্য রোল নাম্বার অনুযায়ী করব, কিছুদিন এগুলো হবে। ওরা একটু এক জায়গায় দুজন নতুন থেকে গেলে তারা মাইক্রোস্কোপই ঠিকমতো হ্যান্ডেল করতে পারবে, একজন আরেকজনকে হেল্প করো। ওকে, সো after focus the fine adjustment screw can be used. Okay, she will also help you. I am also there, but you have to take the help of your friends. So here, see, for 50 students only one faculty, so ultimately you have to learn. So don't do that. The lab technician, the faculties will help you, but also take the help of your friends, especially those who are new, and read from the books. This is the actually maybe the toughest topic in hematology practical, the toughest which are in your syllabus. So do this. Other topics we will try to arrange some classes. She is also new. তোমরা তো আগে পুরনো, ওকে মাইক্রোস্কোপের পার্টস আগের সপ্তাহে ক্লাস করেছিল, আস্তে আস্তে বুঝিয়ে দেবে মাইক্রোস্কোপের পার্টস গুলো, মাইক্রোস্কোপের ম্যাগনিফিকেশন কি করে হয়, কন্ডেন্সার পজিশন যারা আগে থেকে করছো এগুলো জানার কথা। when we focus with the 10x lens, objective lens, condenser position is lowest. Okay, condenser দেখিয়ে দেবে, condenser position জানো, 10x লেন্সে condenser position is lowest. 40x এ যখন করবে, এখানে তো 100x লাগবে না RBC তে। In case of RBC counts, 10x and 40x will be used. Whenever focusing is done with 10x, you have to adjust the condenser position to the lowest. Okay, and when it is 40x, then condenser position has to be somewhat in the middle. When 100x lens is 100x lens means this one, it is written over here. Okay, so there, that is called the oil immersion lens, not required for this experiment. Then the condenser position is highest. It is required in something called the differential leukocyte count. Normal saline দিয়ে খালি জল দিয়ে তো হবে না, ওই ট্যাপ ওয়াটার দিয়ে নর্মাল স্যালাইন দিয়ে পিপেট করে ওয়াশ করতে হবে। ল্যাব টেকনিশিয়ানকে বলো করে দেবে। সব এইভাবে রেখে দিয়ে চলে, ওই ভেতরে আগের ব্লাড রয়ে গেছে, ওই পিপেটে করে বেরিয়ে যাবে। দেখো যদি তাতে যদি হয়ে যায় ভালো। লোয়ার গ্রিডে কি যায়নি নাকি? যদি আপার গ্রিডে গিয়ে থাকে ওতেই কাউন্ট করার চেষ্টা করো। একদম ওটাই প্র্যাকটিস দরকার। প্রথম দিনই একদম চার্জিংই পুরো ঠিক হবে না। অলরেডি ফোকাস করেছিলে? ফোকাসে আছে তো, মানে দিলে এখন ফোকাসে আসবে, হ্যাঁ করে দেখো। These are the cells after fine process, but dilution is incorrect. It's obviously incorrect dilution, otherwise it cannot be. If blood is diluted 200 times, that is the requirement of dilution properly. If blood has been diluted less, then this thing will occur. Density of cells, yes, coagulated. Yes, density of the cells is more, then how will you count so many cells? It is not possible to count cells. That's why the dilution is required. So this blood has not been diluted due to faulty technique or whatever. If sometimes but same fluid is working for others. This is happening with those who are not diluting. Dilution is improper. So if it is less diluted, so many cells, RBCs are huge in number. That's why the 200 dilution has been standardized. Now if you say you have taken blood and fluid such that it is diluted only 50 times, then the density of cells will be so much that it will not be possible to count. Mathematics remains same. If you can count this is, you are considering it 200 dilution. Actually, maybe it is just 50 dilution. If you take more of blood and less of diluting fluid, then the dilution factor will come down. Mathematically, it will remain similar. But it is not actually possible to count cells like this. So that 0.5, taking fluid up to the required amount, mixing it, all these steps are important. So exactly means 0.5 should be. If it is blood, instead of 0.5, if it is 0.8, 0.9 blood, the dilution factor comes down. At this point, there is nothing to do. If you count these cells, considering that the dilution factor is 200, then the counting will be wrong. This is actually less dilution. So what you can do, one thing you can do is that you count these cells, see how many it comes, and then adjust that is back calculation, adjust the dilution factor like that, I have taken blood instead of 0.5, I have taken blood up to 1. If it is, you have taken blood up to 1, it is 100 times dilution. Okay, that is, so then there is faulty, that is some, in the whole process, there has been some mistake because of faulty technique, because if it was in every microscope or all these, because the fluid has been supplied from the same container, so there is no problem with the fluid. Problem is faulty techniques. 2 or 3 microscopes I am seeing that this has come like